Hello, everyone. Next, we're going to learn about stroke care. Stroke, commonly known as apoplexy, refers to a group of sudden onset conditions caused by localized cerebral circulatory disorders, characterized by focal neurological deficits such as paralysis and aphasia, which are common features of acute cerebrovascular diseases. Symptoms usually last more than 24 hours. Talking about strokes, let's talk about mini-strokes. A mini-stroke is also known as a transient ischemic attack if the symptoms of a stroke last only a few minutes to tens of minutes. The signs and symptoms disappear within 24 hours, and there are no signs of neurological impairment. We call it a mini-stroke. A mini-stroke can develop into a full-blown stroke in subsequent stages. We should pay attention to it. What are the risk factors for stroke? We usually classify these risk factors into two categories: modifiable and non-modifiable. Among these, modifiable factors are the key focus for stroke prevention and treatment. These factors include high blood pressure, high blood cholesterol, coronary heart disease, diabetes, and other chronic diseases, and poor lifestyles such as smoking, alcoholism, physical inactivity, high-salt diet, obesity. What about non-modifiable factors? They include age, sex, race, and genetics. We can classify strokes into two broad categories based on the nature of the lesion: hemorrhagic strokes and ischemic strokes. Among these two categories, cerebral hemorrhage and cerebral infarction are the most common. Cerebral hemorrhage is the rupture of a blood vessel in the brain parenchyma. Cerebral infarction. The most common types are cerebral thrombosis and cerebral embolism. Cerebral thrombosis, cerebral atherosclerosis, atherosclerosis of the cerebral arteries, narrowing of the lumen of the main arteries or branches of the brain, blockage or formation of blood clots, causing a localized disruption of blood flow to the brain tissue. The blood flow to the brain tissue is interrupted, and ischemia and hypoxia occur. Let's look at cerebral embolism. Cerebral embolism occurs when any type of embolus in the bloodstream, such as a blood clot from the heart's atrial wall, enters the intracranial arterial system, causing occlusion of the blood vessel lumen, causing ischemic necrosis in the corresponding blood-supplying area. Cerebral thrombosis, cerebral embolism, and cerebral hemorrhage. These are the three most common types of stroke. These three common types of stroke are distinctly different in terms of age of onset, history, and mode of presentation. Among these types, cerebral thrombosis and cerebral hemorrhage are most common in people over 50 years of age, while cerebral embolism can occur at any age. In terms of medical history, cerebral thrombosis is often associated with atherosclerosis, hypertension, hyperlipidemia, diabetes mellitus, or transient ischemic attacks. Cerebral embolism is often associated with rheumatic heart disease, embolism-producing heart disease such as atrial fibrillation. Cerebral hemorrhage usually has a history of high blood pressure. So in terms of the mode of onset, cerebral thrombosis is slow in onset. It typically develops during quiet rest or sleep. Cerebral embolisms are more rapid in onset. They commonly occur during activity. Cerebral hemorrhage has a rapid onset. Most often occurs during emotional stress or activity. After a stroke occurs, the main symptom patients experience is hemiparesis. Hemiparesis is generally defined as paralysis of the muscles of the upper and lower limbs on one side of the body, contralateral hemianopsia, visual field defect, and inability to gaze towards the opposite side of the lesion. Other symptoms may include aphasia and ataxia. Headache, vomiting, and impaired consciousness may also occur. In cases of hemorrhagic stroke, headache, vomiting, and impaired consciousness are typically more pronounced. In severe cases, patients may experience coma, convulsions, or even death. Next, let's examine the treatment of stroke. The treatment of stroke in the acute stage aims to save lives, reduce mortality and disability rate in the recovery period. The focus is on rehabilitation exercises to restore daily living abilities. In the acute stage cerebral hemorrhage, surgical or non-surgical treatments can be used to achieve dehydration, reduce intracranial pressure, and regulate blood pressure, reduce further bleeding, among other goals. Early thrombolytic therapy for cerebral infarction is especially important. Early thrombolysis should be administered within 6 hours of symptom onset to reopen the blood vessels. Timely restoration of blood flow. This can save the tissues around the infarction to prevent the expansion of necrosis. Therefore, patients should be sent to the hospital for emergency treatment as soon as possible after onset. To avoid delaying thrombolysis. In order not to miss the best time for thrombolysis, each of us should be able to recognize stroke at an early stage. Currently, the FAST assessment method is commonly used to quickly identify stroke. The method is simple and practical. FAST is an acronym for 4 English words. The first letter F stands for face, representing the face. We need to check if the patient's face droops when they smile. Arm, ask the patient to raise both arms to check if one arm drifts downward weakly. Speech, check if the patient's speech is slurred. Does the patient have slurred or difficult to understand speech? Time, if any of the above signs are present, call emergency services immediately. Additionally, T stands for time. You must get to the hospital as soon as possible. Then some students may ask, is it acceptable to transport the patient to the hospital ourselves? We do not recommend transporting the patient to the hospital yourselves, because we may not know which hospitals have thrombolysis capabilities. So this decision should be made by Emergency Medical Services 120 to a hospital qualified to perform thrombolysis. Upon arrival at the hospital will open a green channel. The patient will be rushed to the CT room immediately. If the CT results show a cerebral infarction and not a cerebral hemorrhage, the patient will be taken to the interventional suite for thrombolytic therapy. As we emphasized earlier, everyone should be able to recognize a stroke. Now you tell us, what should you do if the following happens to your Grandpa Zhang? When you were feeding him this morning, you noticed that Grandpa Zhang's mouth was drooping to one side, but when he went to bed last night, you saw that he was still fine. Or if Grandpa Zhang wakes up, he told you, I feel some numbness in my right hand and foot, and I feel weak. As a carer, what should you do? Or, you took care of Grandpa Zhang today. You noticed that Grandpa Zhang has slurred speech today. What should you do? Or maybe Grandpa Zhang will tell you, he suddenly felt numbness on the right side of his face, and you notice his speech isn't as clear as usual. What should you do? Or maybe Grandpa Zhang is usually very mobile. Today you asked him to lift his hands. He can't lift his left hand. What should you do? If you've just remembered our FAST assessment method, then your answer must be to consider, Grandpa Zhang has had a stroke. I have to call 120 immediately. While waiting for the ambulance, we need to keep the old man lying down, undo his collar. If he becomes unconscious and vomits, we should tilt his head to the side to prevent vomit from being inhaled into the lungs and cause pneumonia. Next, let's discuss the daily care of stroke patients. After a stroke, patients and their families often struggle to accept the situation. We need to help the patient and her family to face the situation positively. We need to instill confidence in the patient and family, and actively participate in rehabilitation. At the same time, ensure the patient's family prepare for long-term rehabilitation and other necessary preparations. We should emphasize early rehabilitation training. After the disease is stabilized, the earlier rehabilitation training begins, the better the outcomes will be. Avoid rushing through exercises. Adhere to gradual rehabilitation exercises. We should emphasize proper daily care. Due to the limb disability of stroke patients, daily life activities are limited. We need to do a good job of basic care. Prevent pressure sores, urinary tract infections, pneumonia, and other complications. At the same time, we need to emphasize, patients should maintain as much independence as possible in self-care. For example, many patients eat very slowly, with food often spilling onto the floor. Even so, we have to encourage the patient to feed themselves independently. This is a good rehabilitation exercise for the patient. It also prevents further loss of function. Now, let's learn about stroke prevention. Before learning about stroke prevention, let's take a look at the prevalence. Strokes are characterized by 3 high rates: high morbidity rate, high mortality rate, high disability rate. 75% of affected individuals lose their ability to work. 40% experience severe disability. If severe disability occurs, this will bring a heavy burden to families and society. That's why we should focus on prevention. How to prevent? We focus on 3 key aspects. First, adopt a healthy lifestyle. Second, intervene in controllable risk factors. Thirdly, avoid triggering factors. As for healthy lifestyles, including smoking cessation, reducing or eliminating alcohol consumption, regular work and rest, emotional stability, a balanced diet, and regular exercise, studies have shown that a healthy lifestyle can prevent 80% of cerebrovascular diseases and type 2 diabetes, 55% of hypertension cases, 40% of tumor cases, thereby preventing strokes. Previously, we have classified the risk factors of stroke. We divided them into two types, modifiable and non-modifiable. Among them, modifiable factors are the main focus of stroke prevention and treatment. We should actively prevent and treat related diseases, including hypertension, heart disease, coronary heart disease, atrial fibrillation, diabetes mellitus, and hyperlipidemia. At the same time, we should emphasize smoking cessation and alcohol reduction, weight control, etc. Avoid triggering factors. Common triggers of cerebral hemorrhage include emotional stress, excitement, exerting too much force, forceful coughing, sneezing, or defecation, lifting heavy objects. It is important to emphasize that patients should avoid these triggers. Cerebral thrombosis often occurs without an obvious trigger. It most often occurs during quiet rest or prolonged sleep. When patients overeat, consume insufficient fluids, or experience excessive fluid loss, high-fat diet, cold stimulation, and other factors can increase blood viscosity or slow blood flow, thereby increasing the risk of cerebral thrombosis. That concludes this section. Thank you.